Everyone wants to know, how long does the lipedema stay off after surgery? Today, we're going to review an article that lets you know just how many years that you can expect improvement after lipedema liposuction. Hi, I'm Dr. Elston, and today we're reviewing an article on improvements in patients with lipedema 4, 8, and 12 years out after liposuction surgery. So one of the nice things about this article is that it helps to give us a sense about how you might do long-term after you have liposuction for lipedema. Patients always want to know, how long is this going to last? If I do surgery, is it going to come back? Is it going to go somewhere else? Well, this is about the best evidence that I can find that shows the long-term relief after lipedema liposuction. So they've done studies 4, 8, and 12 years out on the same group of patients. And what they find is that 12 years out, there's still a lot of improvement in symptoms. So patients still have improved cosmetic benefit as well as a lot of improvement in their symptoms. So what symptoms are we talking about specifically? We're talking about bruising, we're talking about swelling, we're talking about the need for conservative therapies such as MLD or compression garments. We're going to dive into it a little bit more and talk about some of the findings of this study right now. If you're enjoying this type of article review, or if you or someone that you know has lipedema, please consider sharing this with them, and also please consider subscribing to this video for more lipedema videos and information. Getting into some of the results of the paper here. So improvement persisted with regard to spontaneous pain, sensitivity to pressure, edema, bruising, and restriction of movement. The interesting thing to me about this is that while some patients lost weight after surgery, some patients also gained weight, and despite whether or not you gained or lost weight, you still had persistent reduction in symptoms, which I think is really good, because some patients, as they get older, it's harder to lose weight, but it's good to know that even if you gain weight, you're not necessarily going to gain back weight in the areas that have lipedema, and you'll still have improvement of your symptoms. So if we're offering surgery as the best available treatment right now for lipedema, the question is, will this come back? And I think patients want to know, is there evidence to suggest that this is going to help me out long term? If your insurance doesn't cover it and you're paying out of pocket, it's a lot of money, and you want to make sure it's a good investment of your money and your time. So this study, what I really enjoy about it is that we're now looking out 12 years in time at a snapshot of these same patients, and we're finding that yes, it actually does stay off and the symptoms do stay better.
What? Look at those, 2 of them. Oh my God.
One of the biggest things I tell patients that's a negative about me is that even if you like my surgical skill and you like my bedside manner and everything's going great, I haven't been out for 10 or 12 years in practice. So studies like this that are 12 years out help me, because then I can leverage the knowledge of others and previous studies and people's previous experience and use that to incorporate it and help educate my patients. As most people know, with lipedema being covered by insurance, one of the ongoing requirements is that you continue conservative therapy, including compression garments, plus or minus manual lymphatic drainage. This study shows that 46% of patients needed less or no compression at all afterwards, which is a really big deal. Even if you feel like you might benefit from the compression, knowing that you're going to need it less and you're going to have to go get MLD less is a pretty big win. So what they find is that approximately 30% of the group studied at 4, 8, and 12 years didn't need any conservative therapy at all, which, 1 in 3 chance of not needing anything moving forward after you're done with your surgeries, I think is a pretty big deal. I think the other thing to think of is that when you look at overall improvement after surgery, you have to imagine 12 years of feeling better. Even if you don't get the maximum amount of improvement, 12 years of feeling better and having increased ability to do exercise, to take care of yourself, wearing clothing that fits, I think that's a really big deal, and that would really move the needle for a lot of patients. The average age of the patients at surgery was 41 years old, and these are kind of like your prime years for being out and doing things. You may be a grandmother or you've got young kids at that point, and I think it's a pretty big deal to be able to be active, feel good about yourself, not have spontaneous pain all the time, get good rest at night. So I think that shows that knowing these patients at the average age of the study were 41 and that they're going to get 12 years of minimum benefit in their life, I think that's a really big deal. One of the things I really like about this article is that it breaks it down in these really easy to understand tables. So even if you're not like a scientist, a physician, you don't need to be like a doctor to read these tables and understand. So looking here, you've got spontaneous pain. Before liposuction, it's up, and at 4, 8, and 12 years, it's down. And it's like that for all the things that they studied. Sensitivity to pressure, down. Edema, down. Bruising, restriction of movement, cosmetic impairment. All of these are significantly decreased and persistent over 12 years. Then looking finally at quality of life, significantly better. The reduction is down. Overall impairment, down. I mean, it really speaks to how powerful and effective this surgery can be and what an impact it can make on a patient's life. If you liked this video, please consider sharing it with someone or liking it down below. If you want to learn more about lipedema information, how we treat it in our clinic, consider subscribing. We're trying to put out a lot of good lipedema information, and we hope that you find value from this, and thank you for listening.